Welcome back, my dears. Welcome back, everyone. Today, we are going to talk about a new part of the dementia. And we talked before about the Alzheimer's dementia, and it was related to the scientist who discovered it in 1906, and his name is Alzheimer. He discovered this kind of dementia on 1906. Today, we are going to talk about new types of dementia, like remember together what we said about the vascular dementia. And also, we will just start like talking about remember the Alzheimer's and talk about the irreversible forms of dementia as well. The irreversible means cannot be healed, cannot be treated. It's progressive and it will go on its own way and it will never stop, and it will continue and proceed into being harmful for the human until it goes from the starting stage into the middle stage and to the final stage at the end, which makes the patient fully independent on the others, which cause panic to the individual and cause panic to his family as well. So here today, we will talk about the irreversible forms of dementia. The first thing is Alzheimer, and we said Alzheimer, we talked about the Alzheimer before, and here we will remember just what we talked about. There is a warning signs. There are warning signs for the Alzheimer's disease. Yes, there is. So what are those warning signs for the Alzheimer's disease? Actually, first of all, the memory loss, affecting day-to-day abilities, forgetting things often, or struggling to retain new information. It's difficult for this kind of patients to get new information, and to keep on the old information what they have in their memories. It's very difficult for such a kind of people who are developed by the or attacked by the Alzheimer. Second thing, difficulty performing familiar tasks. The familiar tasks like driving, snowing, cleaning the snow, or so on. All these things are very difficult to be done. Shopping, all this. Forgetting how to do something you have been doing in your whole life, such as preparing a meal or getting dressed, as example. So in that case, this is another sign for Alzheimer. Third sign is problems with languages and forgetting. Always to forget the languages, but if it is a second language, you might forget it totally. But if it is the first language, you may forget some words. You may forget some alternate names, put alternate names for something like the glass or the spoon or whatever. You might forget the names of them and put other names around. Disorientations also in time and space, not knowing what day of the week it is, getting lost in a familiar place, or not knowing about the rituals for the people who are praying, don't know what kind of the prayers is, how and so on, how to do the prayers and so on. Disorientation. Impaired judgment, which means not recognizing a medical problem that needs attention, or wearing light clothes on a cold day. So as example, the Alzheimer's patient might go and wear in a very cold day, might wear a light clothes, or in the summer he might wear a very heavy clothes, like warming himself, though it's very hot. And also in the traffic lights, if it is red, he might pass. If it is green, he might stop. He might be confused. When should I stop walking, and when shall I walk? Problems with abstract thinking as well, not understanding what numbers signify on calculator, for example, or how they are used, what are the numbers and how do you use them. Misplacing things, putting things is not in its place, like the iron, he put it in the freezer, or whatever. Changes in mood and behavior as well. The mood, it changed from easygoing person to quick-tempered person. It changes in personality, like we say, behaving out of character, such as feeling paranoia or threatened, loss of initiatives, losing interest in friends, families, By other meaning, we all have the social needs or the needs of belonging, but in this case, he doesn't have any social needs because he's just like he doesn't want to go to involve in social activities or social relationships. He fear or he avoid talking to the people or so on. Usually occurs after the age of 65. This is Alzheimer and is often diagnosed after the age of 80. However, it can also affect people in the 40th and 50th as well. And we said this before, we talked about this before. But the vascular dementia is regarding the amount of blood which reaches the brain. It might be affected by a stroke or any reason that makes the flow of the blood which goes into the brain become less. So vascular dementia, sometimes known as multi-infarct dementia, is one of the most common forms of dementia, second only to Alzheimer's diseases and in older adults. Vascular dementia is caused by chronic reduced blood flow, like reduced blood flow to the brain. Is the reason for the vascular dementia, usually as a result of stroke or a series of strokes. Let me go back a little bit up and just remember things about dementia and the types of dementia and the facts around dementia. And let me just show you a map here. We'll go back to page 29, but just first see here. That's what I want. You can see now types of dementia. The Alzheimer is around 60-70% of all the people of dementia sick with the dementia or progressed with the dementia or developed dementia. Alzheimer comes 60 to 70%, but vascular dementia is from 10 to 20%. But wait a minute, it's irreversible. So it's also cannot be treated and cannot be healed up, cannot be recovered. So patient will never get back to his own previous situation. So vascular is 10 to 20% of the people who had dementia. But the Alzheimer's is the major one and a big portion, like you see here, around 70%, from 60 to 70%. We'll go back to slide number 29, where we stopped, and we said this is the vascular dementia. And we know now that the vascular dementia is less than the Alzheimer dementia in the percentage or the ratio that a person over 60 years old can be exposed to. Just I want to go right now into a small video. I'll talk about the vascular dementia just 1 second. We'll go to a video. I'll just put my camera off for a few minutes. And we'll go right dementia. Here, any videos regarding the vascular dementia, including all what we need. This one is about 5 minutes. Let's go to someone which is, I think this one would be nice. Let's go to talk about this, the vascular dementia here.
Number 40, the feeling of finding something to watch before this ad ends.
With vascular dementia, vascular refers to the blood flow to the brain, and dementia refers to problems like poor memory, difficulty communicating, and difficulty learning new information. Vascular dementia is also known as multi-infarct dementia, and it's a progressive loss of brain function caused by long-term poor blood flow to the brain, typically because of a series of strokes. Okay, let's start with some basic brain anatomy.
As you saw just now, the reason is a lack of the blood, which is carrying the oxygen and carrying the nutrition for the brain. So there must happen, it happened like there happened a deficiency in the brain in that case. Yeah.
The brain has a few regions. The most obvious is the cerebrum, which is divided into 2 cerebral hemispheres, each of which is divided into 4 lobes: the frontal, parietal, temporal, and occipital lobe. The frontal lobe controls movement and our personalities. It also handles our ability to count and spell and make decisions. The parietal lobe processes sensory information, which lets us locate exactly where we are physically and guides movements in a three-dimensional space. The temporal lobe plays a role in hearing, smell, and memory, as well as visual recognition of faces and languages. Finally, there's the occipital lobe, which is primarily responsible for processing visual information. All the cells in the body need oxygen, but that's particularly relevant for neurons, which can only function in aerobic conditions, meaning with a constant supply of oxygen. Neurons also don't have long-term energy stores, so they need a constant supply of glucose to keep working. Each time the heart beats, about a quarter of the blood pumped out goes directly to your brain via the internal carotid arteries and the vertebral arteries in the neck. Once they reach the base of the brain, these arteries join to form a ring called the circle of Willis, which then branches off into smaller and smaller arteries, the smallest being the perforating arteries that eventually supply the entire brain with oxygen and glucose. Vascular dementia develops in some individuals when atherosclerosis starts to form in the arteries. That's when there's a buildup of plaque that thickens and hardens the artery wall. When this process affects the arteries supplying the brain, like the carotid arteries, it leads to a gradual decrease in blood flow to the brain, which is called chronic ischemia. Sometimes small parts of the plaques can break away, and these bits can drift up towards the brain and can then eventually block a smaller artery, completely stopping the blood supply to the part of the brain that's supplied by that artery. Other times, tiny perforating arteries are affected by atherosclerosis and can get completely blocked off by plaque growing within them. Regardless of the cause, once blood supply to the brain falls below the demands of the tissue, it's considered an ischemic stroke.
That's what we want right now, guys. That's what we want. We want to talk about the strokes. Because the strokes means the blood which reach into the brain is not enough, is not sufficient. Due to one or more reasons, in that case, that will lead into the vascular dementia.
Tissue damage from an ischemic stroke is usually permanent because the tissue gets damaged and the dead tissue liquefies in a process called liquefactive necrosis. Brain tissue necrosis leads to a loss of mental functions governed by that area. If another stroke happens later on, more brain tissue might die off, and over time this damage gets worse and worse. The final result is dementia, a persistent loss of mental functions that is severe enough to affect a person's daily.
So that was about the chemical or the chemical part of the dementia. I just want to go back into another video about the dementia's behavior and what do the people with the dementia do. Just let us go into small. Let me see here. We are talking today about the vascular dementia.
Another type of dementia is vascular dementia. And so what will happen in vascular dementia is people will have little, typically what we'll see is people have small, tiny strokes in the front parts of their brain. And these little strokes, people might not even know that they're having them. It's not your classic stroke where, you know, half of your body goes numb and you lose motor functioning, where you clearly know you're having a stroke. A lot of times in vascular dementia, people, the strokes are so small, they don't even know they're happening. But they happen after a while, they accumulate, and these vascular lesions impair cognition. And so most commonly what we see is that we see an accumulation of small, tiny strokes in the front parts of the brain, and people start to lose their cognitive abilities. Of course, we also see dementia from the large classic strokes as well. And so these large classic strokes where people do lose, you know, motor control on half the side of their body, and they do lose sensory functioning on half the side of their body. Of course, those can lead to dementia as well. More commonly, it's these small ones that we'll see.
So it's all about, you know, no enough blood goes to the brain. That's the reason behind what's happening in that case to the patient that he will start feeling forgetting and so on. That was about the vascular dementia. Let's go now into complete our PowerPoint slides and go to the vascular dementia, which we talk about. It is, you may come on gradually or suddenly, and the speed of progression varies based on the person. So in the vascular dementia, it might happen, the consequences might be very severe for someone and might be slowed down and gradually for another person. It depends on the person himself, depends on the age of the person, and so on, and depend also on how far the stroke affected the brain. Common mental, and we'll see also a video about this as well, but we'll just go first for the common mental and emotional signs. Here it is, and symptoms of vascular dementia. So the vascular dementia points, there is emotional aspects, emotional signs and symptoms in this kind of dementia. Like as example, thinking becomes very slow. The things which I used to do in the past very quickly takes from me thinking few seconds. Now it might take hours. Memory problems, general forgetfulness, always forgetting, unusual mood changes. As example, you feel depressed and you are irritable. Like as example, feeling very nervous and very tempered and very moody. Hallucinations and delusions as well. Disorientations, which may get worse at night. Personality changes and loss of social skills. Like I said before, here you are trying to avoid the people. The patient of the dementia is always trying to avoid people, especially his beloved, like his friends and so on. He's avoiding now, instead of conducting friends and contacting them and communicating with them, he's trying to avoid all this. That is for the vascular dementia. And also, I just want to take this title like this and just put it here and look for something regarding this point also. I wish we have something that will help us to understand as well. Here it is. Let us see this. It's about a person who's living with vascular dementia.
What you're going to lose next. You just have to wait and see. Oh, when I first met Ronnie, I was 14.
It was through an accident that we actually met. I was cycling around Loch Lomond with our brother. He got knocked down.
So the gentleman that actually hit my brother brought Ronnie home to tell my mom.
Olive actually answered the door, and she was brushing her hair at the time. Well, she was gorgeous.
Ronnie is a painter and decorator by trade, and he did up my brother's room for him coming home. And so I'd stand and watch him do it. And then he asked me out. And that was it. January, 4 years passed. He noticed my mental arithmetic was starting to go. And I was always very, very good at mental arithmetic. I couldn't remember words. I have to explain what the word is. And then Ronnie would tell me the word I was looking for. That's why I thought it was time to go and see the doctor. He says, well, we'll take a scan. And then he told me that I had vascular dementia. Well, I didn't really know what that was at the time. From my understanding is that your brain will die, but not in a specific order. So you don't know what you're going to lose next. You just have to wait and see.
an awful lot does go through your mind. Is there a time limit to this? Or will it go on, for quite a long time? Am I going to be feeding her or something soon? Sometimes I wish that I'm going to go first when the time comes, so I won't have to see it. She's always been very good at holding her feelings back, but I've known Olive too long not to realize that it is something that's eating away at her. It's not her doing it, it's the dementia, and that's not her fault.
I mean, a lot of people just keep saying, well, there's no way you've got it. And it's not something you can see. It's not like a cut or something like that. So the fact that you've got to explain is difficult because the different types of dementia aren't really known that well. Research is so important. I don't think anything will happen within my future, but they may be able to find something that can even slow it down. And you've got to have the money for research to do it.
And more funding for this particular part, which will help a lot of humans in the world to be rescued if they have a financial support for the lab researches and so on, for new medications and for alternates to help them to get out of this puzzle that is the dementia in general and the vascular dementia in particular. That was a point now, and we said slow thinking, memory problems, unusual moods changes, hallucinations and delusions, disorientations and personality changes, and loss of social skills. And that was for the dementia. The two types when we compared yesterday between the Alzheimer and the vascular. Again, I will go to talk about the dementias. We have two types, the reversible and the irreversible. Reversible dementias like depression, delirium, emotional disorder, metabolic disorders, and this all can be healed up. I mean, the patient can be recovered back, partially recovered or 100% recovered. But in the irreversible dementias, the patient is not able to get back to track as he was before, or because it's a progressive disease. Also, we talk about the reversible forms of dementia like metabolic problem, brain injury. Once these things is cured, then position will be back to normal. Here also we have the brain tumor of the person who's alcoholics, nutrition deficiencies, especially the lack of vitamin B1, B3, and B12. Infectious, maybe there's many infectious can lead also into the type of the reversible dementia. Also, we talk about the poisoning, and we said the poisoning is one of the reasons also, like the pollution and the ingestion, which we are living nowadays in the world of we are living. The pollution and so on also might be a reason, one of the reasons for this. We talk also about the Alzheimer's disease and the related dementia. And we said, like I showed you right now, please don't forget this figure. Here we have Alzheimer's disease and vascular. The Alzheimer is around 70%, but the vascular is from 10 to 20%. I'm repeating this back so everybody know it. Front temporal dementia, 10%, and this is another part. Dementia with Lewy bodies is 4%. Younger onset Alzheimer's is 1 to 5%. Others included, like for this Huntington's, is around less than 1%. But the majority, like you see here from the dementia, is Alzheimer's disease, and it comes in the first place, and vascular dementia comes in the second place. In this graph, it's very important also. Here we have the types of dementia, the Alzheimer's disease, vascular dementia. We talk about those two till the moment. We didn't talk about dementia with Lewy bodies and front temporal dementia. We didn't mention them, but those two are, like you see here, Alzheimer's 70% and vascular is from 10 to 20%, which always, if you take the maximum number, 70% plus 20% means 90% of all the cases of dementia due to Alzheimer in the first place and vascular dementia in the second place. For the types of dementia, like we said, we have also dementia with Lewy bodies, and this is what we'll talk about later on, and the front temporal dementia. Here it shows the Alzheimer and vascular and others all together. Persons with dementia is caused by Alzheimer's disease. This is a relationship between the types of dementia. We talk also about compare between Alzheimer and vascular dementia in the previous lecture. We have also a secondary dementias. What are the secondary dementias? Secondary dementias results from the physical efforts of disease process, ingestion, and injury. And that's what we said. Those are the secondary dementia, which is here. Let me go back to the figure here that is reversible. It's called secondary dementia. It is reversible. Okay, that was for those points which we talk about for the vascular dementia. We'll go now to dementia with Lewy bodies. Dementia with Lewy bodies, DLB, is one of the most common types of progressive dementia. Progressive, the word progressive means it doesn't go back. The person will never get back to normal. The central features of DLB is progressive cognitive decline, combined with three additional definings. We have severe fluctuation in alertness and attention. For example, sleep disturbances and frequent drowsiness, like lethargy or lengthy periods spent starting to into space or disorganized speech. Also, there is recurrent visual hallucinations. We have also Parkinson's disease, like motor symptoms such as rigidity and the loss of spontaneous movement. People with DLB also may suffer from depression. The last type is frontotemporal degeneration. Dementia is another type of dementia. This is another type of dementia, actually, the frontotemporal. It accounts for about 5%. Like when we go back, let me show you here again in our figure. When you come to see here, you will find the frontal temporal dementia around from 5 to 10%. Here it is. Frontotemporal dementia. That's around 5 to 10%. Here it is. Dementia is another type. It accounts for 5 to 10%. And generally occurs between the ages of 40 and 60. This comes to people relatively younger in age, from 40 to 60 years old, with women slightly more affected. Yesterday, like we were talking about the dementias, and we said in general, women are more exposed to be affected by dementia more than men. We said women are more exposed to be affected by dementia more than men. And we showed the curves also. I will show you just the curves again, which shows here. If you guys remember, we talk about the curves of dementia. And we said that in women, dementia is more than men. problem, but it's okay. We'll get back to it right now. So here it is. Parkinson and front temporal degeneration also are two types of dementia as well. Okay, this is the secondary dementia. What is the Parkinson's disease dementia? Let's go to it and watch a video about the Parkinson disease dementia. Then we'll get back to talk about the Parkinson first. Okay, let's go to this one and watch what we mean by Parkinson dementia, the third type of dementia, which we talk about now.
Okay, the next type of dementia that I wanted to talk about is Parkinson's disease. Now, Parkinson's disease is a disease that is defined by its symptoms, signs and symptoms at presentation. So the first sign that we see with Parkinson's disease is a tremor at rest. Okay, so that's number one. Number two is rigidity. And you can see they have sort of this stooped posture and a very rigid spine, but really they have rigidity of all the muscles in their body. So number two is rigidity. Number three is bradykinesia. And this sort of gives them, actually the rigidity together with the bradykinesia gives them this sort of slow, let's see if I can write this, bradykinesia gives them the slow shuffling gait that you see with patients with Alzheimer's disease. And then just gait disturbances in general. So they're having trouble walking. Okay, so those are the four defining features of Parkinson's disease. Now, there are several different types of Parkinson's disease. There is primary, and primary is usually caused by Lewy body dementia. And then there is secondary, and secondary could have a whole lot of causes. Causes that we think of commonly are pugilistic, so patients that have been hit in the head a number of times, like Muhammad Ali. Medications can cause Parkinson's, like the Parkinson's syndrome, and brain lesions, particularly brain lesions in the midbrain. Okay, so remember, Parkinson's disease is a syndrome that is made up of these four symptoms grouped together. Okay, so we are going to focus from now on primarily just with Parkinson's symptoms, the Parkinson's syndrome.
I think this can show you the role of the personal support worker in such cases, and we will talk about this in this with the details. What's your role as a PSW in helping these people, because they move from partially independence into totally dependent. They depend on the others and everything on the last stages of the role. So, stages of Parkinson's disease, there are many stages for the Parkinson's disease. And also, I just want to get another one here, simple one. Just let's go to it and see.
Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I'll discuss Parkinson's disease. Parkinson's disease is considered a neurodegenerative disease because it involves the degeneration and death of neurons. It is most frequently seen in adults over the age of 50. The most recognizable symptoms of Parkinson's initially are movement-related and generally involve a tremor that is worse when a person is at rest, bradykinesia, which is slowness of movement, rigidity, and postural impairment. Parkinson's patients also often experience non-motor symptoms like cognitive impairment or psychiatric symptoms. The causes of Parkinson's are not fully understood, but a combination of genetic and environmental factors is likely involved. Parkinson's patients have low levels of the neurotransmitter dopamine in the basal ganglia, a group of structures involved with movement, among other functions. These low dopamine levels in the basal ganglia are caused by the death of dopamine neurons in a region of the basal ganglia called the substantia nigra. The substantia nigra has high numbers of dopamine neurons, but by the end stages of Parkinson's, patients have often lost more than half of the dopamine neurons in this region. The most common treatment for Parkinson's involves an attempt to restore depleted dopamine levels in the basal ganglia. Because dopamine does not cross the blood-brain barrier, dopamine cannot simply be administered to a patient. Instead, however, patients can be given a precursor to dopamine called L-DOPA. L-DOPA can cross the blood-brain barrier and is used by the brain to synthesize more dopamine. This can lead to improvement in the motor symptoms of Parkinson's, but L-DOPA does not halt the neurodegeneration that occurs in Parkinson's disease. And long-term use of L-DOPA can cause a number of side effects, including movement-related problems. So it's not a cure for the disease, and other treatments are still being explored.
Okay, guys, we'll move forward right now into another points after we talk about the dementia and we talk about the Parkinson's. We talk about types of dementia. We'll move to another points here right now in these slides. We said that the Parkinson is a progressive illness that affects the brain's ability to control movement. The reasons for the Parkinson's is still unknown. Tremors, stiffness, slowness, difficulty walking, loss of balance, and in late stages of illness, people may also develop dementia. So it might go into dementia at the late stages. What about the Parkinson's symptoms? What are the symptoms which you see when you see someone, you say he's attacked by or affected by Parkinson's? First of all, memory loss. There is common symptoms. The first of all is memory loss. Difficulty concentrating, is very difficult to concentrate. Difficulty thinking or completing routine tasks and navigating the environments as well. People with Parkinson's disease may also develop depression. This is another point with depression. Another type we want to talk about is called Jacob disease. Jacob disease, a very rare disease that causes dementia. One of the reasons to cause the dementia is Jacob disease. Appeared to have a genetic link of susceptibilities in 5% to 15% of cases. Can be passed on through infected brain tissues. Can live in the body for years before. So the incubation periods of these tissues, infected brain tissues, it might reach into years, like saying it latent in the cells of the brain and is not active for many years. Disease becomes obvious, occurs in people between the age of 50 and 70 years, and is very rapid. So this is about Jacob disease. It's a progressive neurological disease that can affect both humans and animals as well. So it's not only for the humans, Jacob, it goes also for the animals. Early signs and symptoms: difficulty sleeping, fatigue, insomnia, excessive sleeplessness, we are anxiety as well, progressive deterioration of memory, changes in personality, depression, delusions, and hallucinations. It is usually rapidly fatal. In last stages, the client will have poor balance and pain, which will cause increasing problems with stability and walking as well. So it's not only Alzheimer, but it goes also into Jacob. The Winkel-Kraskov syndrome is also, WKS is a brain disorder that's caused by lack of thiamine or vitamin 1, affects the nervous system, including the brain, and they usually associated with alcohol use disorder, heavy alcohol consumptions over a long period. So that is regarding One of the things also, that's because of what? Because of lack of vitamin B1. The causes of WQS: impairment of memory and intellectual or cognitive skills, such as problem solving, of learning, as well as symptoms of nerve damage, including damage to areas of the brain. The most distinguishing symptoms of confabulation details believable stories. So, like he's like making superstitious stories, like situation to cover the gaps in the memories. We will go now to another topic, the signs and symptoms of dementia. We talk about two types of dementia, reversible and irreversible ones. And we talk also about Alzheimer. We talk about Parkinson's. We talk about vascular dementia. We talk about Jacob disease. And these are all reasons for dementia. Now we will go to the next part, which is the dementia stages. We have 3 stages for the dementia: the early stage, and we have the middle stage, and we have the late stage. We have 3 ages for the dementia. In the early stage, there is mild changes in memory and thinking, some difficulties with daily tasks. Here I am in this point. Let me get the pen here so you can see, guys, very clear here. So dementia stages, the first stage is the early stage. In the early stage, mild changes in memory and thinking, some difficulties with daily tasks as well. So what we concerned about, plan now for the future changes. We plan, we're still having the warning sign about the worst is coming. So at least we have to plan. Not the case, like as example, patient will not be planning, but who is around him, like his beloved and healthcare providers and so on. Action, evaluate risks at home, check out for the risk. If there is something risky at home, slippering, things like, we will reach the limit that if you are a PSW and you have a case of dementia, even in the early stages, and he won't smoke, don't leave him alone, because you don't know what he will do or she will do. Can be things like car keys, guns, or another household appliances. Plan for future changes at home. So make the home more safety, because the worst is coming. The worst did not happen yet in the early stages. The worst did not happen yet. But try to reduce the risk to its greatest extent. This is the meaning of it. So this is the first stage, the early stage. Second stage of dementia is called the middle stage, and we will go for more details about this topic after a little while. So the dementia stage, the second one, the middle stage, the symptoms here are moderate changes in memory and thinking, may have behavioral changes like hostility, agitation, anger, paranoia, hallucinations. All this also comes in the middle stage. But here, there are more deterioration in the memory. The memory goes down more and more. Concerns can often no longer leave alone. Now, if here in this stage can be partially independent, here he must be dependent. There must be someone to assist the patient, he or she. Actions, limit unsupervised access to firearms and driving. Supervise when at home, because he needs someone to watch him, or she needs someone to watch her. The late stages. In this stage, the person who's affected with the dementia will be totally dependent on the others, the healthcare providers, his beloved, people who are around him, and so on. Symptoms, severe changes in memory and thinking, may have behavioral changes, need help with most or all daily tasks. So here are the symptoms of the late stage. Symptoms, severe changes in memory and thinking, many have behavioral changes, need help with most or all daily tasks. Concerns, need full-time support. And the action, so here is totally dependent now. The patient, he or she, is totally dependent. They cannot live alone. They need to be very supervised by the healthcare provider, PSW or a nurse or whatever, and by the people, his beloved people, his family. Actions ensure no access to firearms, also like here, and driving requires full-time supervision. Here, the supervision when at home, but here total, because here he is now totally 100% dependent. In the early stages, must have future changes at home, but here partially supervising, here totally supervising. That was in very simple the dementia stages. We are talking about the irreversible kind of dementia, means which is progressive and which do not go back to track, or situation will never get back to normal, and or situation will also go back to the worse, will go to the worse. It's a progressive means will go to worse. That's why we say progressive. So we have here now the dementia stages, the 3 stages, the early stage, the middle stage, the late stage. I just want you to know the main aspects of them. Then we will come now and talk later on about the role of the personal support worker in each of these stages, the role of the healthcare provider, what's his reaction, the code of conduct in the health service provider, and the duties and the responsibilities in each stage from these 3 stages, the early stage, the middle stage, and the late stage, and what he should do. That's what we will be practicing after a little while. But here now, I just want to go into, we have to watch videos always, and I put for you guys the links of these videos inside the notebook, inside your own PowerPoint. Here, dementia stages. Here we go, the dementia stages. Some of them put it in 3 stages, some of them put it more, less. However, we will see the dementia stages like I will just put something which is very easy. Let's go here and see this one's 2 minutes or 3 minutes.
Hi, this is Zoe from Care Patron. Before you watch this video, don't forget to like and subscribe for more content like this. A dementia stages chart is a crucial resource used to depict the various stages of dementia, a complex and progressive neurological disorder. The chart maps the progression of dementia into typically 7 stages, from no cognitive impairment to severe cognitive decline. These stages are meticulously outlined to encompass cognitive symptoms, behavioral changes, and loss of functionality, both for Alzheimer's and vascular dementia. By understanding stage-specific symptoms and needs, caregivers, healthcare professionals, and family members can develop tailored care plans, set realistic expectations, and communicate more effectively with each other. This systematic approach enables them to provide targeted support and treatment, enhancing the quality of life for the person with dementia. Dementia stages charts have revolutionized how dementia is managed, bringing coherence and empathy to an otherwise overwhelming journey. Whether it's monitoring daily changes or planning long-term care, this chart is an indispensable guide. To use our dementia stages chart, follow these steps. Download our dementia stages chart from the Care Patron platform, which you can find in the link in the description. The chart divides dementia into stages, from the pre-dementia phase to severe cognitive decline. This helps engaging the progression and predicting future care needs. The 7 stages of dementia chart serve as a roadmap, guiding caregivers and families through the complex journey of dementia. The chart describes specific cognitive behavior.
Here we go just now. No cognitive impairments, very mild cognitive decline, mild cognitive decline, moderate cognitive decline, moderately severe cognitive decline, severe cognitive decline, and very, very severe cognitive decline. Cognitive is meant the mental decline, like the functions of the brain and so on. So it goes in 7 stages. Shall see this in details on the next part. We'll go right now into 1 or 2 questions we'll put here. We end this part with 1 or 2 questions based on what we understand today. Let's say here, let's add here new slide, and I would say questions. First question: there are many reasons that cause dementia. Discuss. Discuss the main types of dementia. Of course, you'll talk also about Parkinson, you will talk about the vascular dementia, you'll talk about the front temporal dementia, and we will mention those also as well. Third, discuss in brief the major 3 stages of dementia. So these 3 questions right now, we need to stop here for a few minutes and for you guys to give me an answer of these questions. You may write these answers inside your notebook. You can write the answers. You have a notebook, then we can also get it from the notes which we are working from, or we can Google search as well. So we can Google search as well. These are our 3 questions. The first question is here. Here we go. This is our first question. Second question is discuss the main types of dementia. You will mention also the vascular, Alzheimer. You will mention Parkinson. You will mention Jacob. Those types of reasons for the dementia and types of dementia as well. So here, these are the 3 things. Plus also you will see the 2 types, the main 2 types of dementia, reversible and irreversible. Shall stop here like around 5 minutes to get your answers before we move into the next part of our own work. Thank you so much. We'll stop here to see these questions now. Please write the answers inside your notebook, and we can Google search for more things like researches or whatever, update our knowledge. Yes. Second thing, discuss the main types of dementia. Third, discuss in brief the major 3 stages of dementia. Shall stop here a few minutes to get your answer, guys, before we move to the next part. Thank you.